Hi, this is Dr. Juno. So I just wanted to give you a little more information because I always like giving information. What would a session look like? And then what am I doing in the session with you? So a session takes about a half hour, sometimes a little bit longer. You go in and schedule. I get a notification. You get a notification to do the intake forms. I really appreciate the intake forms. I do have a medical background, 30 years of experience, and I like to give you a holistic experience. I want to know what's going on for you. I want to know your history. But we don't have to go into a deep dive of every detail. We can get a lot of information without having to go through every little piece. We go through what's important. And if we book more sessions, then we get to know each other more that way. Then what is that? So then we get really cued in on like what exactly are you looking for? If you looked at the other video on the vagal nerve reset, and what we're doing, it's really important if you can to get into very specifically what thing are you wanting to change. It's nice to have something that's tangible, like a behavior, a pain level, and or like being able, like if you're looking at a cognitive thing, what is that cognitive thing? Not just 10% better or everything's better. That's not what we're looking for measurable outcomes. And when I've been talking about this, the vagal nerve, we've talked about the 40 hertz. I just want to do a quick little, in case you didn't watch that vagal nerve information, it is the information superhighway between the brain and nearly every organ, and its dysregulation can manifest in ways that seem completely unregulated. That's why you could have a hiatal hernia and think you're dying of something because it can be so severe in its symptoms. Common dysregulation are things with it's the parasympathetic nervous system is underperforming. So your rest and digest system, digestive stress, anxiety and hypervigilance, heart rate variability issues, keeping the calm heart, chronic inflammation, sleep disturbances. Less common, but sometimes more severe, is when you're actually getting into having trouble, difficulty swallowing, dysphagia, voice changes. And this is interesting because we're going to get into this part. The vagal nerve, like the voice can change and it can have like a monotone or tired voice. And this is interesting. Loss of gag reflex and fainting or extreme lightheadedness, known as vasal, vasovagal syncope. And this can be related to blood pressure as well. Brain fog, biliary issues, which poor gallbladder controlled, and malabsorption of B12. So here's what I want to say, the technology I use. So then what I'm doing when I talk to you, we're doing this interview, I record your voice for 15 seconds. And talking about that voice in relationship to the vagal tone, and if the vagal nerve is not toned, it can get dysregulated. There's a lot more information than just that. And then, so then this will take it and compare it to the 0 to 10,000 different frequencies, the hertz that I have in my system. And if you're someone that's into like scalar rife technology, that's all in there. But right now, I really want to talk about this part of it, the voice algorithm that we record the voice, and then it comes up with comparable database measuring compared to it breaks your voice down. So I'll just show you that really here. You don't have to know all this, but for those people who really like to get in on that information, I want to give it to you. I use the fast Fourier transform FFT. It's an algorithm to compute the discrete Fourier transform, and it's a mathematical tool to convert a signal from the time to a frequency. So it is domain, so it's amplitude over time, and it gets converted into amplitude over frequency. So I don't know if you like that stuff, but I do. And I'm still trying to absorb it all. It's really cool technology that I've been using now for a while. So if you're listening to a musical chord, your ear hears a single complex sound wave, but your brain can distinguish between the individual notes that make up the chord. And the FFT does this. It takes the digital sound and compresses it into a collection of sine and cosine waves. So it's breaking it all down into waves and then it's comparing those, basically what those pictures look like. So let's look at this. This is what that can look like right there. So the rectangular function, the time domain into frequency domain. And is this technology used elsewhere? Yeah, this is used for digital audio for MP3 compression, digital imaging, telecommunications, and image processing. Um, and then just in general, like there's a lot of different ways. I was going into the 40 hertz for regulating the vagal nerve, but there's lots of different ones. And this is just a more specific way. It gets so specific, and there's so much in there. I'm here to help you sleuth through that along with along as helping you like, oh, there's a lot of inflammation here. You might need more support than just the sound therapy to reset the vagal nerve. So that's what that looks like. Oh, the other thing. So I like to sit there with you and record the sound with you. So basically, we go through, we find out that particular place that you want help changing with, that is a tangible thing to see the change in, the behavior. As we went, if you look at that other video, we can go into behavior changes and the science behind it. So let's look at the behavior, the whatever that is, the disassociation, the whatever that moment is for you. We do that. I'm going through and looking at things. I might ask you questions on what I'm seeing coming up based off what we just talked about, these comparable frequencies, and there are a lot, thousands. And I have a way to kind of sleuth through that. I might ask you some questions and let you know what I'm seeing. And then I come up with a 5-minute treatment protocol. I sit there with you and listen to it, and I record it with you. So it's both of us just sitting there to contemplate. This is to help and train what you want to have happen in your body. You are visualizing as if it's already happened to reset your biochemistry related to that circumstance or that behavior. So that is a nice, and you just do it the best you can. It doesn't have to be perfect, but we have that 5 minutes, and I sit there with you and I sit there with it. And I want you to have that entrainment with me after we've done all this discussion together. And then I send you that video clip, and then you get to listen, sorry, auditory clip, and you get to listen to that at least a couple times a day, sometimes three, and then especially at the time of incident. So especially when you're feeling that dysregulation. Also, I do advise that the first few times you listen to them, that you do it at home with some time, just because it can have, while some people don't notice any major effects, I've had quite a few people who have had, they can feel things moving in their body, they can feel tingling, they can feel something in their ear. Some people, their vision changes a little bit. And I want to make sure that you're in a safe place to just listen to the sound, at least initially. And then if you feel safe with that, like you've listened to it and you feel fine, don't worry about it. But it's kind of like I wouldn't have someone go, you know, get acupuncture and drive a car. Could you do it and be fine? Yeah, but let's not do that. So I hope this was helpful. If you have any questions, feel free to send me an email. My email is at the very top on the right side up there. And I appreciate your time and hanging out with me right now.